Hello, my name is Duyen. I am doing scenario 9. Today's date is March 10, 2020. It's currently 6:15. I'm going to compare the physician order sheet with the MAR. The right patient is nursing Jake, nursing Jake. The right PHIN is 312-654-654-987-987. The right date of birth is January 1st, 1960. January 1st, 1960. The right doctors, Dr. Skills Lab. Dr. Skills Lab. Both the MAR and the physician order sheet indicate no known drug allergies, but I will verbalize with the patient before I give him the drugs. The right drug is cephalexin. Cephalexin is a suspension. The right dose is 150 milligrams. 150 milligrams. The right route is PO. The right time and frequency is TID, which means 3 times a day. TID 3 times a day. It's scheduled 3 times today. The first dose is scheduled for 6 o'clock. That dose has not been given yet. It's currently 6:15. Therefore, I can give that drug. It is also signed by 2 nursing transcribers. The next drug, the right drug, is baclofen. The right dose is 20 milligrams. The right route is PO, which means oral, PO. The right time frequency is TID, which means 3 times a day, TID. This drug is scheduled 3 times a day. The first dose is scheduled for 6 o'clock. That dose has not been given yet. It's currently 6:15, so therefore I can give the baclofen. It is also signed by 2 nursing transcribers. The right drug is lantanopros. 0.005%, 0.005%. The right route is 1 drop to both, 1 drop. The right, The right dose is 1 drop. The right dose is 1 drop. The right route is to both eyes. And the right time and frequency is daily at HS, which means once a day before bed. Daily at HS. This drug is scheduled for 22 o'clock. It's currently 6:15, therefore I would not give the lantanopros. The right drug is enalapril. The right dose is 10 milligrams. The right route is PO, which means oral, PO. The right time and frequency is daily. This drug is scheduled for 6 o'clock today. That 6 o'clock dose has not been given yet. It's currently 6:15, therefore I can give the enalapril. I also checked that it is signed by 2 nursing transcribers. Next, I'm going to use the MAR to pull out the medications that I need to prepare. So, the right drug is cephalexin. This is cephalexin. It's a suspension. This is for oral suspension. I need 150 milligrams. That's the dose. So in here, it says that there's 125 milligrams per 5 milliliters. So I'm going to quickly do the math to figure out how many milliliters I need. So I don't know how many milliliters I need, but I know that the dose is 150 milligrams. So I would cross multiply that with I know that I have 5 milliliters, and in that 5 milliliters, there's 125 milligrams. So I'm going to cross multiply the 150 multiplied by 5 and divide that answer by 125. And that should give me how many milliliters I need to drop for the cephalexin. So I'm doing 150 times 5. And I'm going to divide that by 125. And the answer I got is 6. 6 milliliters is what I need to drop. I'll show you on my calculator. I got 6, and this is just the scrap sheet that I used to do my math. Okay, I'm going to finish comparing. PO, the right route is PO. That means orally. This is oral suspension, can be given orally. And the right time and frequency is TID 3 times a day. The 6 o'clock dose today has not been given yet. It's currently 6:15. Therefore, I can give that drug. Okay. Next is the right drug is baclofen. This is baclofen. The right dose is 20 milligrams. There's 10 milligrams for every 1 tablet in here. So to get 20 milligrams, I multiply 10 by 2, right? That gives me 20 milligrams, the dose. So I would multiply 1 tablet by 2, which means I need to take out 2 tablets. The right route is PO, that's oral. This is tablet, it can be given orally. And the right time and frequency is TID 3 times a day. The first dose is scheduled today for 6 o'clock. It's currently 6:15, therefore I can give that drug. And lastly, the right drug is enalapril. The right dose is 10 milligrams. In here, there's 10 milligrams for every 1 tablet, so I only need 1 tablet. The right route is oral. That means this is a tablet, so it can be given orally. And the right time and frequency is daily. That means it needs to be given once a day, and the dose is scheduled for 6 o'clock today. It's 6:15, therefore I can give the enalapril. Next, I'm going to prepare the drugs. And before I do that, I'm going to be checking the back to make sure that to make sure that they're not expired. So I checked the cephalexin, it's not expired. I'm checking the baclofen, it is not expired. And I checked the enalapril is not expired. Okay, I'm going to perform hand hygiene and prepare the drugs now. So first I'm going to prepare the cephalexin. I'm going to shake it up really good. From the math that I did before, I know I need to draw up 6 milliliters. I'm just going to put this cap on the side. I am going to now cap the syringe and tap it so that I can get rid of the air bubbles. The air bubbles at the bottom are gone. I'm going to uncap the syringe and put the lid on its side. I'm going to draw back some of the liquid and then slowly push it up. Oops, there's a little bubble, so I'm just going to redo that. I'm just going to drain out the excess amount. That should leave me with exactly 6 milliliters. Okay, there's 6 milliliters in the syringe with no air bubbles, and I'll just show the camera. 6 milliliters. And I'll spin it around. No air bubbles. Okay. I'm just going to cap this with the paper cup, and I'm going to prepare the label for it. So the patient's name is Nursing Jake. The initials should be NJ. The drug name is cephalexin. The dose is 150 milligrams, and the volume is 6 milliliters. The concentration per ml is 125 milligrams per 5 milliliters, and the date today is March 10, 2020, and it's currently 6:15. And I'm just going to sign with my initials and designation. And I will show the camera my label. Okay. Next, I'm going to be preparing the baclofen. This is the baclofen, and the dose is 20 milligrams. So I'm going to need, in here there's 10 milligrams for every 1 tablet. So that means I'm going to need to pull out 2 tablets. This is 2 tablets. Okay. There's 2 tablets in here, and I'm going to quickly prepare the label for it. The patient's name is Nursing Jake, so NJ is the initial. The drug name is baclofen. The dose is 20 milligrams, and the volume is 2 tab. And today's date is March 10, it's 2020, and it's currently 6:15, and I'm going to sign. And just show you the label. Oops, sorry. There you go. Okay, and lastly, I'm going to prepare the enalapril. So the dose for enalapril is 10 milligrams. In here, there is 10 milligrams for every 1 tablet. So I'm only going to need 1 tablet. Okay, I'll pour out 1 tablet. There's 1 tablet in here. And I'm going to prepare the label. So the patient's name is Nursing Jake, NJ. The drug name is enalapril. And the dose is 10 milligrams. The volume is just 1 tablet. And the date today is March 10, 2020. It's currently 6:15, and my signature I'll also quickly show you the label for that. Oops, sorry. There we go. Okay. Next thing, I will be doing my second check. Okay. So, make sure I have a water cup also. The right patient is nursing Jake and Jay, nursing Jake. The right drug is cephalexin. Cephalexin, this is cephalexin, it's cephalexin in here. The right dose is 150 milligrams, there's 125 milligrams per 5 mLs in here. So the dose is 150 milligrams, and in the syringe there's 6 mLs. I previously showed you, but I'll show you again, 6 mLs in here. Okay? The concentration per ml is 125 milligrams per 5 milliliters. The right route is PO, that means oral. This is an oral suspension, and the right time frequency is TID, which means 3 times a day. The 6 o'clock dose has not been given yet. Today is March 10th, 2020. It's currently 6:15. Therefore, I can give the 6 o'clock dose. Also, I have my initials and designation on the label. Okay, so that's done with. Next drug, I'll put it back, clean up, is the right patient is nursing Jake. The right drug is baclofen. This is baclofen and baclofen. The right dose is 20 milligrams. In here, there's 10 milligrams per 1 tablet, so I needed to take 2 tablets. So the dose, 20 milligrams, volume, 2 tablets. In here, there are 2 tablets, okay? And the right route, PO, that means oral. This is a tablet, can be given orally. Right time frequency, TID, 3 times a day. The 6 o'clock dose has not been given yet. Today is March 10th, 2020. It's 6:15. Therefore, I can give that 6 o'clock dose. My initials and also designation are signed on the label. I'll put that away. And lastly, right patient is nursing Jake and Jay nursing Jake. The right drug is enalapril. This is enalapril. The right dose, 10 milligrams. Here, there's 10 milligrams for 1 tablet. The dose is 10 milligrams. The volume would be 1 tablet. I have 1 tablet in the cup. And the right route is PO, that means oral. This is tablet, can be given orally. And the right time frequency is daily. So it's scheduled for 6 o'clock to be given today. Today is March 10, 2020. It's 6:15. The 6 o'clock dose has not been given yet. Therefore, I can give this drug. I also have my initials and designation signed on the label as well. I'm just going to bring a water cup. And okay, I'm ready to... Oh, I'm just going to clean up, I guess, a little bit. Okay, I am ready to head to my patient's bedside. And before I do that, I will shift the camera. I'm entering the patient's bedroom. I sanitize my hands first, and I introduce myself. Hello, nursing Jake. My name is Duyen. I am a second-year student nurse. I'm here to give you your medications today, okay? Okay. Before I give you your medications, can I please just check your wristband? Okay, thank you. I'm just going to compare the patient's wristband with the mark. So the right patient is nursing Jake. This is nursing Jake. The right PHAN is 312-654-987-97. The right date of birth is January 1st, 1960. January 1st, 1960. And the right doctor is Dr. Skills Lab. Dr. Skills Lab. I also checked the patient's wristband to make sure that there's no allergy band, which there isn't. Okay? And can you please tell me your name? And what is your date of birth? Okay, perfect. That matches the MAR. Thank you. Do you also have any allergies? He says no? Okay, awesome. Before I give you the medications today, I'm just going to do my 3rd check, okay? So I'm going to do my 3rd check now. Okay, the right patient is nursing Jake and Jay. The right drug is cephalexin. This is cephalexin. This is suspension. The right dose is 150 milligrams. The dose is 150 milligrams. The volume should be 6 milliliters. I checked the syringe to make sure that there is 6 milliliters in the syringe, and it is. The concentration per ml is 125 per 5 milligrams per 5 milliliters. The right route is PO, which means oral. This is oral suspension. It can be given orally. Right time and frequency is TID, which means 3 3 times a day. The first dose for 6 o'clock has not been given yet. Today's date is March 10, 2020. It's 6:15. Therefore, I can give that drug. Next, the right drug is, next, the right patient, nursing Jake, and J, nursing Jake. The right drug is baclofen. The right dose is 20 milligrams, and the volume should be 2 tablets. I check inside the cup to make sure there is 2 white tablets, and there is. And the right route is PO, which means oral, and the right time frequency is TID, which means 3 times a day. The first dose is scheduled today for 6 o'clock. That dose has not been given yet. Today's date is March 10, 2020. It's 6:15. Therefore, I can give this drug. And the next drug, the right patient is the right patient is nursing J, and J, nursing J. The right drug is enalapril. The right dose is 10 milligrams. Dose 10 milligrams. The volume is 1 tab. I check to make sure there is 1 tablet inside. The right date is, the right route is PO, oral. This is a tablet, can be given orally. The right time frequency is daily, which means once a day. The 6 o'clock dose today has not been given yet. And today's date is March 10, 2020. It's 6:15. Therefore, I can give that dose. Okay, I have completed my 3rd check. I'm now going to educate my patient. Hello, nursing Jake. Before I give you your drugs, I'm going to raise the height of your bed to my waist, and I'm going to sit you up in a high Fowler's position, which you are in. Awesome. Okay. And before I give you these drugs, I'm just going to give you some background information about what you're going to be taking today. So the first drug you're going to be taking is called cephalexin. It's an antibiotic for your urinary tract infection. Some side effects you may feel are rashes, you might get diarrhea, and also cramping. So if you have any of that, please let me know immediately. Some things you should know about taking this drug is you want to increase your fluid intake. So you want to try to drink 8 to 10 glasses of water a day. And also, you don't want to be drinking alcohol when you're taking this drug. Some things I'll be monitoring for before I give you this drug is your vital sign, particularly your temperature, okay? And afterwards, I will be, again, checking up on your temperature as well as looking at your urine lab test to see what's going on there. This medication should be taken with food, so I'll make sure you take it with food. The next drug I'm going to be giving you today is called baclofen. So baclofen is a centrally acting neuromuscular relaxant. Sorry, not neuromuscular. It's a centrally acting muscular relaxant. So it's going to help you relieve your pain within your muscles, stiffness, and any muscle spasm related to your multiple sclerosis. Okay, some side effects you may feel is fatigue, headache, and nausea. So if you feel any of that, let me know. Also, some things you should know about taking this drug is that you don't want to be doing alcohol or smoking, and also you don't want to be doing any hazardous activities. So you can't be working with machines or operating a vehicle. Okay, and some things I'll be monitoring you before I give you this drug is your neurological and respiratory activities and status, as well as your pain level. So I'll be doing that, and afterwards I'll be checking up on your pain level and your muscular activities, okay? And this drug, baclofen, can be taken with or without food. So lastly, I'll be giving you enalapril. Enalapril is an antihypertensive. It's used to lower your high blood pressure. So some side effects you may feel is a dizziness, fatigue, or headache. So if you feel any of that, let me know. And also, something you should know about taking this drug is you don't want to be changing your positions too quickly. If you're lying down, you're getting up just too slowly. And also, once again, you don't want to be doing any hazardous activities, so you shouldn't be driving a car or operating any machines. Some things I'll be monitoring you for before I give you this drug is your vital sign, particularly your blood pressure. I don't want to give it to you if your blood pressure is already low. Also, you want some things I'll monitor afterwards giving you this drug is your blood pressure again. I'll be looking at your intake and outtake as well as your renal outputs. Okay, and this drug should be taken with food. So, okay, now that I've given you that, I'm going to administer the drugs. So first I'll give you your cephalexin. Here you are. And here's the water. I watch to make sure that the patient fully swallowed. Next I'll give you the baclofen. There's 2 tablets in here. And here's your water. I watch to make sure that the patient fully swallowed. And lastly, I'll give you the enalapril. There's just one tablet in here. And I give the patient water. And I watch to make sure that all the drugs went down. Okay, and you're feeling okay? Okay, thank you, Nursing Jake. After giving you these medications, you still have to be sitting up just because you've just eaten and taken your medications, but I will lower you down your bed to make sure that you're comfortable. So I lower down the bed. I will also leave the call bell within your reach, so if you have any questions, concerns, or feel any of the side effects I told you about before, please call me. I will come immediately. Yeah, so do you have any questions or concerns? No? Okay, awesome. I just quickly check to make sure the patient is in a safe position, they're comfortable, there's no hazards around them. Okay, thank you, Nursing Jake. I'll see you again soon. And I leave the patient's room. Okay, now I'm just going to clean up and document on the MAR. I'm going to sanitize my hands and document on the MARs. So I will document next my initials and designations next to the drugs and times that I administered. So I initial D.N, which is my initial, and then my designation U of M student nurse 2. Next to the drugs I gave, and next to the time that I gave them, which is 6 o'clock. And I'll quickly show the camera. I documented next cephalexin 6 o'clock, baclofen 6 o'clock, and enalapril 6 o'clock. Okay, thank you. That is my med admin.